You're good.
Hello, everybody, and welcome to Trexler Scout Reservation. We are today up here at Settlers Camp doing a little bit of a piece for our friends down at Aquila Land. Today, my name is Adam McChonis. I'm the camp director at Settlers. This is my wife, Gabrielle.
Hello.
She is a Huck Tech in the ICU at Lehigh Valley Pocono. And today we're going to be talking about first aid and asking some questions. So here we go. All right, so what do you do at the hospital as a Huck Tech?
At the hospital, I mostly kind of care for patients with activities of daily life, help the nurses with different medical treatments within my scope of practice, help with CPR, life-saving aid if needed.
Awesome. Now, you work in the ICU, so that's a bit different than most of the areas in the hospital. Can you tell us a little bit about that?
Yeah, ICU stands for intensive care. So patients that are too sick to kind of be handled on a normal floor where nurses and doctors are come into a place called an intensive care unit where there's a special team of doctors and nurses caring for that patient, where they monitor them much more closely. And if patients were to need something like life support, we are able to facilitate that there as well.
Awesome. So now that we've kind of established you know a little bit about what you're doing, let's talk about some first aid and some scouting situations. So I know you worked at Aquila Land as the health officer, and you're going to be doing that up here at our camp as well. What are some of the injuries that you see commonly here at Scout Camp?
The most common is probably skin knees from the Gaga pit.
Oh, jeez.
The Gaga pit.
Yeah.
Yeah. So for a skin knee, the first thing we kind of do is we just get them in there, get them calmed down. We'll get their scab or their scrape or whatever it is kind of cleaned up with some soap and water. We try to avoid things like peroxide or alcohol because they can be very abrasive and harsh, and they hurt really bad.
Yeah. I don't like when they use that on my knees.
Yeah. So then once we get it cleaned out, we dry it off a little bit, put some first aid spray on it, any kind you got, whatever you like, and then some triple antibiotic ointment and a Band-Aid.
Now, I think it's pretty important that we clean it out and put all that stuff on there, and let's find out why.
If you don't clean out a cut and you get any debris or dirt in there, sometimes things like bacteria can be hiding in some of the debris or the dirt that you might have gotten into a cut, and you can get an infection. Infections can make you really sick. Sometimes it'll start out with a little bit of redness around a skin knee, and then some swelling, and then it'll start to hurt really bad, or it'll get warm to the touch, and they can make you really sick if you don't get them taken care of.
Well, I know one of the things that I like to do is run around camp in open-toed shoes and Crocs and things like that. I'm just kidding. But what kind of injuries could those lead to?
Definitely some stubbed toes, some scrapes and stuff. You could trip and break a foot or twist an ankle.
That doesn't sound good. Are we able to take care of that here at camp? How would you take care of that?
Yes, we are. So when you're looking for a sprain or a strain or a break, you just kind of assess whatever joint or extremity it is. You look for some swelling, deformity, tenderness on the site, or swelling, and you kind of feel to see if the bones are kind of in place, if they can bear weight on it and it's not bothering them too much. It starts to subside in a day or so. Usually you can just heal it with what we call RICE, rest, ice, compression, and elevation. And if it's anything looking too weird or it's something I'm not sure of, I definitely make sure I send him to the doctor to go get an x-ray.
Right, because obviously we can't do that here at camp.
No, we cannot.
So we've talked about scrapes, we've talked about sprained ankles. We had an issue earlier today with a bee sting. How would you take care of that?
Okay, so bee stings. The first and most important thing you want to know if a friend or someone gets stung by a bee is you want to know if they're allergic. You're going to ask them right away. Now, if somebody is allergic, it can be a life-threatening situation, so you want to get the medical help immediately and help them locate their EpiPen and help them so that they can administer their EpiPen to themselves. Now, an EpiPen, for anyone who doesn't know, is a little pen of medication called epinephrine that helps reduce swelling and closing of the throat in anaphylaxis, which can be caused by reaction to a bee sting. So if they're not allergic, you could just put some ice on the site. You want to make sure you get the stinger out if there is a stinger. The best way to do that is to take the edge of a credit card and just kind of scrape it right along the stinger. You don't want to go against it because that'll push it back in. Try to avoid using tweezers because you can squeeze anything that's left in that stinger into the site. For somebody that's not sure if they're allergic, you just want to look for swelling, difficulty breathing, and you want to just keep a really close eye on them if they're not sure.
Wow, that sounds like a lot. How are we able to prepare for these things, you know, in our everyday lives? If we're going on a hike with our pack or our troop or our crew, what are some things that we should keep with us?
So one of the best things you want to keep with you is a first aid kit. You can have a personal first aid kit, a troop or a pack first aid kit, and you want to keep some basic first aid stuff in there so you can treat basic scrapes, burns, little stings, maybe even a sprain, and you want to be prepared. Make sure you have stuff with you so should any little incidents arise, you're prepared.
Awesome. Now, I used to be the aquatics director, and I know a problem that we had down at the waterfront was you're surrounded by water and it's hot, but the water cools you down, so people forget to drink. Can we talk a little bit about that?
Yes, it is very important to drink water when you're doing any sort of outdoor activities. If you don't drink enough water and you're drinking too much bug juice and you're just not liking the water.
Now, do slushies count?
Slushies do not count.
Ooh, okay.
Water
sorry, kids.
and Gatorade count. You want to make sure that you're drinking enough fluid, that your pee is clear. I know it sounds weird to look at your pee, but if your pee is yellow, you're probably a little bit dehydrated.
Okay.
Dehydration can make you really sick. You can get nauseous, you can get headaches, you can start to feel lightheaded, and if it gets bad enough, you can even pass out, and that can be a medical emergency.
Wow.
So you want to make sure that you're drinking enough water for the activity that you're doing, and make sure you're hydrated even the night before you go on an outing.
Okay. Well, with that, I want to talk about something a little more serious. I had read that the one of the most common major issues that we have in Scout Camp has to do with our adult leaders. Can you talk a little bit about the situation I'm talking about?
Yeah, so one of the emergency situations that could arise, one of the most common ones in adult leaders, especially when you're doing outdoor activities and you're exercising, would be a heart attack. So some of the symptoms of a heart attack, for those of you that may not know, are chest pain, trouble breathing, sweating, pain in your arm, your jaw, and sometimes people start to feel like, you know, they're pulling stuff away from their neck. So if somebody's feeling like that, you want to make sure you get an adult right away, another adult.
Okay.
You want to make sure that you ask them, you know, if make sure that they're breathing, and then ask them if they're allergic to baby aspirin, because when you call 911, they may ask you to get an adult to get some baby aspirin. The best thing to do for them is to get them into a position kind of like this. You don't want to lay them down, because if you lay them down, it can increase their blood pressure or affect their blood pressure and cause more problems. So if they're conscious, you can sit them up like this. They can put their head down. You want to loosen anything you can around their neck, because they're going to feel like they're having trouble breathing, and the most you can get off the chest is the best.
So now, the next step is if they're not conscious or if they look like they're sleeping, I heard you can run up and do CPR, I think it's called.
Well, you want to make sure that you know what you're doing first. You can't do CPR without being certified or without having somebody talk you through it. If you're not certified, sometimes the 911 dispatcher will talk you through it, and that's the only situation where you want to attempt to do CPR without being properly certified. So you want to call 911 and follow their direction. They're going to ask you if they're breathing. They're going to ask you if you can find a pulse, and they'll direct you how to do that.
Okay. Now, can just anybody go get CPR certified? Is that something that maybe we should have a lot of people do if they have the opportunity?
Yes, it's very good. And even for people that don't want to do mouth-to-mouth or rescue breaths, they do have community hands-free or hands-only CPR. And there's not really a minimum age limit, but some people do have requirements for the classes, but usually around age 14, most people are ready to take CPR.
Awesome. Well, I want to thank you for your time. Obviously, we're very busy right now with getting stuff done for the Mincy Trails Base Camp, as well as the Cub Stravaganza. But I think that's been really informative, and I hope you all enjoyed it. So at this time, I'd like to say take care and keep on scouting.